Hey, what's up guys? Welcome back to our channel, The Upper Hand. So as you know, over the past several episodes we've been covering standardized assessments for the upper extremity, and sadly, unfortunately today we're going to be wrapping that series up, but don't worry because we've got some exciting things coming at you next, so make sure to subscribe and stick around for that.
Yeah, so like Dylan said, this will be our last standardized assessment video. Today is going to be all about the O'Connor finger dexterity test. We're going to go straight by the book and show how to administer and score that test. So let's get started. Okay, so the O'Connor dexterity test is designed to provide therapists and other professionals with an accurate and objective measurement of skill, dexterity, and this test is designed to test the patient's ability to manipulate small objects quickly, either with the fingers or with tweezers, and that offers a pretty good predictor of manual dexterity skills. Okay, as you can see, the finger dexterity test is a board. It has 100 holes in the board. Once you slide the little top off, you're going to see all of these pins. And when administering this test, you're going to instruct your patient to pick up 3 pins at a time and to place all 3 pins in one hole. Okay, I'm doing it backwards from this side, but I'm doing it from the patient's point of view. You're going to start with the top left and work to your right. Fill up that entire row before you go down to the next level. You should also instruct your patient while they're performing this test, if they happen to drop one, to just pick up another one and keep going, that there are plenty of pins in here, so if you happen to drop a few, you're going to be able to have enough to fill up the entire board. So if you are going by the book with this, it does want you to fill up all 100 peg holes, in order to go by the norms that's set forth in the manual or online. As you would expect, this could take some time, especially if your patient has some form of dexterity issue or fine motor issue, which would be why you were doing this assessment in the first place. Okay, so when your patient is ready to perform this assessment, first just make sure they understand all of the rules and everything that's expected of them before they start the assessment. Also, you're going to let them go ahead and have a practice attempt. The manual says to fill in the top 10 peg holes, no more or no less. So when they're doing this practice, they have to go ahead and do the entire top row. So we'll go ahead and let Dylan practice that. And again, so Dylan is right-handed, so he's going to be using his right hand, and he's going to be starting in the top left corner from his point of view and working his way to the right side. So he'll go ahead and fill in that entire top row. Okay, so after your patient has had a chance to practice that, you'll go ahead and remove all of those, put those back in the holder. You'll give him a second to rest, just to kind of compose himself, and then you will start the timer as soon as you say begin, and you will not stop the timer until the very last hole. Now, I will go ahead and point out that according to the manual, the way this is scored is by the time that it takes to fill in the first 50 holes, and then you'll get a separate time from the second set of holes, and we will go over how to plug that into their formula to get the exact score later in the video. Alright, as you can see, Dylan's getting pretty close to the end here, so go ahead and be grabbing your stopwatch or your timer and get ready to push that stop button so you can record that time. And stop. Okay, so remember earlier we said we're going to get the score or the time in seconds that it took to fill in the first 50 holes, and then you're also going to have the total amount of time that it took during that time. So all you have to do is subtract the first 50 time from the total time to get the time from your second set of 50. Okay, so a little confusing scoring sheet or scoring method that they have here, but to get your raw score, you're going to take the first half time that we talked about earlier, getting Dylan's time that it took to fill in the first 50 peg holes, and you're going to add that to the second half time times 1.1, and then you're going to divide all of that by 2 to get your raw score. So as you can see in this example here, the first half time was 243 seconds, and the second half time was 225 seconds. So to get this score, you're going to do your 225 times 1.1, and then you're going to add your first half time to that score, or to that number, and you're then going to divide all of that by 2, and your final raw score will be 245.25 seconds. Okay, so as you can tell, this assessment does take some time to complete. So if you're working in a busy clinic and that's just not feasible for you to perform that entire assessment, you can just kind of modify it really however you need to. You can do just half the board and take that score, or if you need to go even quicker than that, you can just do the top row and record that time. You just have to make sure when you go back and give it again in a few weeks, you're consistent with your scoring and you can actually track if they're improving or not.
And so another note is that even if you're not using this as a standardized assessment, this comes in handy as an activity for patients. Obviously these holes are big enough to place 3 pegs in, but you could place 1 peg in at a time. There's a ton of ways to grade this up and down and to modify it. For example, you could, if you have a pair of tweezers in your clinic, you may take a pair of tweezers, and you may have a client who does some kind of fine motor work on their job. So say maybe a dentist, for example. You could have them take the tweezers and place 1 peg into each hole as practice for something they may do on the job, like using small tools. So there's a ton of ways to use this as an activity, even if you're not using it, again, as a standardized assessment.
Hey guys, thank you so much for taking time out of your day to watch this video. We hope you learned something today and that this was helpful to you in some way.
So you know our goal for this channel, The Upper Hand, is to give you guys the upper hand as you seek to better understand conditions of the upper extremity and just all topics related to occupational therapy in general.
So please take a second out of your day, make sure you like this video and subscribe to this channel so that you can be sure that you're going to see all of our upcoming videos. Thank you guys so much, and we'll see you next time.